sometimes if you have access to information, then you can get things done faster. You can get to where you're going much faster. So the way I'm going to do this session is simple. I'm going to tell you about my career, like how I came to where I am right now. And then I'm going to talk about ways for you to uh, get to where I am faster, if I might say it that way. And then I'm just going to open the floor for questions. And then I think doing this in the Q&A format will be much more useful to everyone. So just a brief overview of how I got to where I am. So I studied medicine. I went to OAU in Nigeria, and then for while I was in medical school, that was when I sort of got interested in technology. I mean, in digital technology. Let me use the word digital technology in that sense. So built my first startup with a couple of medical students when I was in medical school. Ran it for a year, thereabout, and then medical school got busy and then we sort of shelved it. And then when I finished medical school, started working on another startup. So between um when I finished medical school and I think 2017, I worked on two or three different startups. Then sort of happened on the one that we ran for 5 years, which we eventually sold to another startup eventually. So as at the time when I was done with medical school, I realized that I really didn't want to practice as a clinician. So, but the interesting thing is that even if you don't want to practice as a clinician, you can still, be in this field. So don't assume that, for you to do AI, you have to leave clinical practice. I know over 20 to 50 doctors who are practicing. So I'm not talking about doctors alone. You can be a nurse, you can be a physio, you can be a lab scientist, whichever um, role is your primary training. You don't have to leave your role. So that's just what I'm trying to say. But for me, I realized I didn't want to see patients. So I did a master's in public health and then started working with a consulting firm in Nigeria. Worked there for about, I think 2 years, 8 months. And then I sort of realized that, my personal passion lies in digital technology and now we can use it to improve outcomes. And my training, as you know, was in medicine or healthcare. So I started to do a PhD in health information sciences. Now, health information sciences, which people call health informatics, is the area of healthcare that deals with, applying anything that has to do with technology, data, I mean, digital technology in that sense, and data to healthcare. So data science is a branch of health informatics, anything around, applying AI machine learning, which is sort of like, very similar to data science, is also under health informatics. Anything that has to do with, building digital technologies for healthcare is under health informatics. Anything in general that has to do with, even stats, technically sort of, not it's not directly on the informatics, but it's a branch of health informatics in that sense. And then when I was, doing my PhD, I started working on a couple of I took classes on AI. So took AI classes, took introductory classes. Before then, I had done online courses. And then I took introductory courses on AI, took on some advanced courses on AI, started working on a couple of projects that was, leveraging machine learning models. And then uh, did that for about 3 years. Now, one of the things that I didn't mention in that whole process is that even before I started doing started working fully in AI, on the side, I was, like I said, I took online classes, but on the sides, I was, um, I was doing projects. I was doing multiple projects that sort of had to do with AI. So, for example, I I built, they talk about the first health insurance stuff that was built, and I worked on that project with a couple of other. And the way it happened was just that, I was interested in saying, how can we use AI to, make a difference in that specific field? And then we just brought a couple of people together and we started experimenting, and then we sort of ended up with, building something that was like the first. So been built, anywhere in the country. So that is what happened. So that is like the trajectory of my career. Right now, I work in consulting, healthcare consulting, where we use AI models. Now, in my present job, I don't build AI models, but we apply AI models to support multiple healthcare companies to deliver better services to their members, to their clients. Let me use the word clients. So that is what I do presently. So the idea is that there's a lot of opportunities in AI. So the problem people have with AI is that when they think about AI, they think about sitting down to code, for example. Not everybody that works in AI codes. It's great to know how to code. Like I'll tell you, it's great to know how to code. I code, for example, I code in Python. It's very great to know how to code, but not a lot of people, not everybody that works in AI knows how to code. There is a whole lot of areas in AI where you would not have to be coding actively. That is what I'm trying to say. So, like I said, I'm going to talk about my career, how I got to where I am, and then now I'm going to talk about if hypothetically, let's assume you want to start in AI today. What do you do? That's the way that's the way I'm framing this part. Now, if you're going to start in AI today, let's assume you just finished. Okay, I'm going to give three scenarios. So scenario A is let's assume you just finished um, let's assume you just finished high school. That's scenario A. Scenario A, let's assume you just finished high school. You're interested in AI. One of the things you could do, easiest thing to do is that you go ahead and take you apply for a course in maybe computer science, or some schools actually have data science degrees where you can work in, you do data science degrees. Some have computer science degrees. And then you focus on AI. You focus on AI and machine learning in whatever you're doing for that specific degree that you're taking. So that's like a straight short way, like straightforward way. And then you're thinking of in that case, you're going straight into like AI, not specifically AI for healthcare. Now, the good thing with applying healthcare to AI is that if you notice, when anybody talk about AI, one of the first places they want to apply it is in healthcare because that is where people feel there is the highest chance of making an impact. So that's like a straight shot way. Finish, you have interest in AI, you have some experience you have some good grasp of maths. Not you don't have to like you don't need to be like a maths guru or something, but you have a good grasp of maths. Then just apply, do a computer science course or data science course or an engineering course where you have to apply AI, where you have to apply machine learning or any other kind of course, that any other what I'll call stats heavy course. Even if you do maths, for example, you do maths and then a quantitative heavy course, that's it. But I'm going to assume that most of the people in this room are people who do not, I mean, who are not looking for what's the word? Who are not looking for, who are not just trying to get into college. So I'm going to assume most of the people here are professionals who already either they're in school already doing a course or they are working already in a specific area. So that is what I'm going to assume. So if you are in that category, I'll say you gonna look like me in a way because as you can see, I never studied I never studied computer science. So what you can do, what I would say you can do is one of the ways to do that is a lot now. The great thing about this age is that information is very ubiquitous online. There are lots of free courses. There are lots of free programs. There are lots of free opportunities for you to learn. So what you need to do, what I would say you should do is, get online, apply for an open course, and then take an introductory course to artificial intelligence and machine learning. That is what I'll say. And that's what I did. That is what I personally did. I took I think it was a Coursera. Yeah, it was a Coursera course to introduction to AI that I did. And then they give certificates too. So do that. once you've done that, try to take once you've done, like, you've gotten the basics, like, how to write basic code in Python or whichever language you choose. But mostly right now, the language of AI is Python. So whichever one you choose, and you've sort of gotten the basics. The next thing to do is go to Kaggle. So there's a site called Kaggle. Kaggle has this lots of data. Like, one of the problems people have is that, you have these ideas and you want to build something and you want to test something. You need data. So Kaggle has a lot of data, and they have a lot of projects. They have a lot of uh what's the word? Challenges that you can sort of take on. Try to take on those challenges and try to solve those problems. Try to build your own look for a problem in that you're interested in. Get the data on it, and then create a model to sort of solve that problem in that sense. Solve that. It doesn't really solve the problem in that sense, but at least to solve the problem, to show that, okay, we can use this model to do A, B, C, and D. So do that. Keep doing that. Keep doing that. But assume you're working, you're in your you're in your regular field, you're working, but keep doing that. Once you've done that, go online and then try to take an advanced course. So there are advanced courses online that you can take to take you beyond the basics, where you have to look at how to use some of those advanced machine learning algorithms. How to write better code, how to go diving into deep learning, for example. Looking at how to use build image recognition systems. There are a lot of opportunities in that area. So try to do that. But while you're doing all those things, try to get involved in projects. And the reason why I say you should get involved in the projects, so once you get involved in projects, it's easier for you to talk about what you've done rather than to talk about what you're going to do. So let's assume you want to apply for something, you want to apply for a role, or you want to be apply for grad school, for example. Um, Can someone, I think someone is unmuted. Please mute yourself. Yeah. So you want to apply for grad school. It's easier for you to talk about, I did this, I did this, I did that. So try to do that. Try to do more of those projects. But let us assume that you are not even planning to maybe go into grad school. You're just planning to use this in your present work. And that's the interesting thing with AI. Like, if you're a clinician, let's say you are a resident or you're a nurse, there's a chance for you to use AI to improve on how you do your work. There's a chance for you to use AI to improve on how you serve your patients, or how you, in a sense, to improve efficiencies at the place you work. Then just keep learning. Keep taking more classes, and then in your job, you look at things. So for example, I'll give you a very good example. We didn't do the project eventually, but it's a good example of how the knowledge of AI can help in what you're doing. So I have this friend who is an anesthetist in Abuja, and then they have, I think he works at a renal transplant clinic, I think so. So one of the things we're trying to do, so we had a talk once, we didn't build it eventually. But one of the things he wanted to do was that, they had this list of people that wanted to have renal transplants, and they were sort of looking at how to prioritize who to take first. Now that's the classic that's a classic, what I'll say, classic data science question. Like, you have 100 patients at different levels of clinical deterioration, at different levels of renal disease advancement, and at different levels with different existing comorbidity, different existing diseases, chronic diseases, and different existing challenges. So it means that, if you're thinking about that right now, you're thinking of, imagine a table, like a data table, where it says patients A, B, C, D, E, F, G, their age, their sex, talks about the level of the stage in their clinical, of their renal disease. Couple of other things they have is diabetic, hypertensive, has this, and then is on this medication. This is clinical state and things. And so you already, if you sort of worked with data before, you already can imagine that problem as an Excel sheet. 20 columns long, 50 columns long, 100 columns, depending on the amount of data you have. And what they wanted to do was that they wanted to see how they could see who to prioritize. And that's like a classic problem you can solve with AI. So you take that data, you build a machine learning algorithm for you. At times you might not even need to build a machine learning algorithm. You could sort of look at, you could sort of use simple linear regression, which is like statistics, right? Just regular statistics. Someone usually say that, AI, I think machine learning is statistics, in flowery language. It's true to an extent. To an extent, yeah, it's true. But the thing is that so you can just run a machine learning model on that, and then you can say, look at who to prioritize, and then you can now use that to say why are we prioritizing these 1, 2, 3, 4, 5? Oh, okay, these people are the priorities because maybe because of their clinical state, because of the advancement of their renal disease, because of how they've been doing presently on the medications they're on. And then that's you can use AI sort of have a better perspective. And the good thing with AI is that let's assume you're dealing with about 1,000 patients. How do you, as a person, as a clinician, sit down and easily evaluate 1,000 patients to decide who goes first? So with AI, you can sort of use that to help you in making that decision, to narrow down onto specific clusters or to specific people and say, okay, based on this, and then you now look more at those people. You do the clinical evaluation of those people, and then you can go ahead with that. So that was the problem that person was trying to solve. So I'm saying that to let you know that, in your regular job, without leaving your regular job, your knowledge of AI can help you be a better clinician. Your knowledge of AI can help you be a better nurse. Your knowledge of AI can help you be a better medical lab scientist. Your knowledge of AI can help you, do many things, much better. So that's what I'm trying to say. So you do not need to leave your job to work in the AI. You do not need to um, like go into the field of AI in healthcare, as people would like to say it. You know, AI in healthcare means you're using AI in healthcare, just the way the name, just what the name implies. So, like I said, the process, for like a professional is one, there are open courses online. Take those courses. Those courses open your eyes. They give you the regular critical skills you need, and then start working on challenges. The best way to learn is to keep doing. Is by acting. Is by engaging. Is by action. You can keep reading from now to tomorrow, but you learn more by actually doing. So the best way to learn is to do in that sense. So keep taking on those challenges. Look, there are lots of them online. And then there are lots of people around you who have problems that you can use AI to solve. So you can talk to them and then you can see how you can help them solve that problem. That's two. Three is, join a project. If you're learning and you have like three other people around you, you can bring them together and say, okay, there's this problem. Let us work on it together. And then you work on it together, you put it on GitHub, you talk about it online, you put it on LinkedIn, on Twitter, and then people see what you can do. And then you're applying for a job, and then you have an extra skill set that nobody else has, and then that sets you apart. But that's like what I would say is the way to do it. The good thing about the AI field right now is that the entry barrier is very low, like super low, super low. The only place where it's high is if you want to go into AI full time, like you want to like work fully in the field of AI. But if you're not, then the end barrier to being able to know AI is it's just like the way statistics is. People teach themselves how to use Stata, people teach themselves how to use SPSS and all the like. So that's the way it is. So all that being said, I would say right now, what I would like to do is to take questions and answers. And the way we're going to do it to make it easy is you're going to put up your hands. Like there's a raise hand feature. If you go to React, there's a raise hand feature in React, and then we're going to take the questions um, down the line as the way people raise their hands. So just go to the raise hand features, and then raise hand feature. It's in the toolbar below, and then raise your hands, and then we can take questions. I think we don't have questions, so maybe we can end the session. Nobody's raising their hands. Okay, I can see one hand raised.
Hello?
Hold on, Rachel. I want more people to raise their hands. So I want us to have everybody raising their hands, and then we'll take it one by one. Okay, Rachel, Jacob. So I'm taking notes. So I'm gonna call people as they have raised their hands. So Rachel's going first. Jacob next. Okay, Joy next. I don't know who iPhone is, but I'm assuming I'll assume your name is iPhone for now. My apologies. It was. Okay, Cecilia Abraham. Okay. Abraham, Camera, Cecilia. Okay, Aja. One, two, three, four, five, six, seven, eight. So once we get to 10, I'm gonna stop. So uh, hey, all right. So we have eight people. So I think we're just gonna take questions from eight people. Uh, so we're gonna start with Rachel. Rachel, can you just go ahead and ask a question, please?
Hi, Doc. I think I had asked you a question earlier when you were doing the previous session. So I told you that I was a physician and I was interested in clinical advisory in like health tech startups.
Hmm.
So my few questions were, so you had said that we should approach startups and potentially like volunteer. So how do you go about this whole thing of approaching startups? And then also like applying your clinical knowledge into that space, and what do I need to know as a physician, like in this health tech startup space, so that I can give the appropriate clinical advice? Like, what is the bridge I need to have, and understanding I need to have? Because I find it really confusing when I see so many, because it's completely out of the depth for me. So what other, like I asked you earlier about certifications, but what do I need to know exactly when I'm first starting off?
Yeah, I don't think I'm the one you asked because this is my first session today, so I'm guessing someone else. But this is a question I can answer. So what we're gonna do is, Rachel, just I'll ask you to bear with me, and then I'm gonna answer a question last, because it doesn't have to do directly with what I'm talking about right now. But I'm still gonna answer it, but I'm not gonna answer it last. So older thoughts. I know what you asked. I can talk on that, but let's take questions that are like directly relevant to what we're talking about right now. And then I'm going to answer your question after we're done. I mean, not we're done, like once people have left, but after I've answered the last questions, I'm going to answer your question. So I'm going to ask Jacob to go ahead and ask his question. Hello, Jacob, are you there? Okay, Jacob Masenga. Okay, I don't think it's there. So, Joy, can you go ahead, please?
All right, good. Well, it's afternoon. Yeah. So my question, as I'm a medical doctor, I I have a background in digital health, telemedicine. So I actually had started taking a couple of courses around AI. So my question is, how do you fact check what you are doing, or kind of have an accountability structure? So it's one thing to be self-motivated and like take courses and learn, but when it comes to like working on projects, how do you know, oh, this thing I'm doing or this code I'm writing is actually making sense and it's leading to an end goal? Also, mentioned like what taking projects to work on. So does that come from just, I mean, looking for problems and trying to solve that? Or are there structures or opportunities where people can say, okay, there's this project, are you willing to volunteer or work on them? Then are they AI focused startups or organizations that we can look out to work or volunteer with? Sorry, it's a lot of questions, but yeah.
Yeah, so I think I'm going to start with your first question talks about, being able to verify what you're doing. The way to verify what you're doing is simple. That is why one of the things in AI is when people talk about validation. So if you build a model and you want to be sure your model is working, the best way to do that is to validate it. You sort of know the usual test, train, validate stuff. So that's just the way to do it. A lot of the AI models out there are actually not doing that well in that sense, but they are still some of them are just slightly better than chance in that sense. Like some of them are performing at like maybe 60% accuracy, or let's use AUC for example, like 0.6 AUC, which is not bad, which is still something. But the thing is, the way to verify is for you to conduct validation studies, validate your data. If you build something that addresses a specific problem, look for data that you've not trained on and then validate it on it. There's no special way for you to know you're doing the right thing, because the right thing is relative. It depends on what your end goals are. So there's really there's no special way to do that. Just build. The best validation for anything you've built is if it gets used in real life, if people use it and it makes a difference. That's the best validation. Like, the aim of you doing AI is not for you to just build some fancy algorithms and then post it online that I built this. No, the aim is for you to solve a problem. So the validation for whatever you're doing is it solving any problem? That's the validation. That's the way I'd answer that. To your other question about joining projects, the thing about joining projects is easy. It's someone that comes up with the idea of a project you're joining. So you can also always be that person. You don't have to wait for someone to come up with an idea for you to up on the idea. That's the way I'd say it. So what I'm going to say is look for a problem around you. Look for something that you feel is an issue around you. Look for data for it. Try to find data and then work on it. See how you can use AI to make it better. So the example of the health insurance stuff that we built comes to mind, for example. I realized that, the problem we're trying to solve in that was simple. We're trying to solve the problem of people trying to decide which HMO they should go for. So in Nigeria, there are about over 100 HMOs. Each HMO, I mean, there are over 50 HMOs rather. And each HMO has like 2 to 3 plans. Some of them have 6. So if you are a random person and you want to buy health insurance, you want to go with an HMO, how do you choose a plan from 56 HMOs with 3 plans each? How do you choose a plan for yourself? Like it's a question that needs solution. So that, to me, that's the way to frame problems. And that's the way to frame projects. That's the way to frame problems that can translate into projects. So that was our question. How can we help people decide on which HMO is the best for them amongst 50 HMOs and about 156 plans? So if you frame your problem that way, you can always already imagine what kind of project you can build from that. Remember that, and that's why I was intentionally giving examples. I told you about the project in the renal clinic where they wanted to know, how do we prioritize who to conduct renal transplants for? That's a question. You can already imagine what you need. The limiting factor for most ideas you would have is that, does the data exist? For when we're building the HMO one, there was no data. There's nobody that collected the data and kept it somewhere. It didn't exist. So we had to sit down and spend 6 months collecting data and then curating and cleaning that data. So one of the things we did, which is good, is that one of the things we eventually did was to release that data. So the data we curated for that is free online. The problem is outdated because it's data from like, I think 2020, 2020, so it's outdated, but still useful for anybody that wants to build something like that. It's free online. So the data that you find from free online was created by someone. So your project could actually just be curating data for people, which is the project I'm trying to work on right now. So that's the idea. So that's the way to work on projects. There's no special way to it. You look for a problem, you try to build a solution for the problem. Or you find someone who is solving a problem and you talk to them and then you go ahead and build something with them for the problem. That's the way it works. Uh, I don't know who iPhone is, but your display name is iPhone. So can iPhone go ahead and ask the question?
Sorry about that. My name is Adiola.
Oh, okay, no problem.
My first question. So, let's just assume one has, decided to take steps on your suggestion of how we should dive into AI. If one is considering a post-study degree, so like a master's program, which will you suggest is best between health informatics and digital health? That's the first one. Then the second one is, how would you sort of advise that you approach? Okay, let me give an example with where I work. So I'm a nurse clinical advisor in an ambulance service. So bulk of what we do is already telemedicine, but I feel like I'm not having any hands-on experience when it comes to IT itself using AI. I don't know if you get what I mean, like the in-depth of IT. So how would you advise that I sort of approach either the informatics team there or like the IT guys that are really doing the IT job there, and how, AI can be involved in all of this? How would you suggest I approach them? And then the last question is, what are like the possible job titles when you're searching for jobs? I know most of them will not just come as um AI in healthcare. So like, what are like the hidden job titles and the fancy names for these roles that one can be looking out for to apply? Thank you.
Yeah, so the way I'm going to answer your question is that, health informatics or digital health, I think the major thing is it depends on what your plans are. That's the best way to answer the question. What are your plans? What do you want to do with that degree? That's the best way to answer that question. So whatever you want to do with that degree would explain what to go for. Now, the other thing you need to look at is that when you want to apply for the program, you should look at their curriculum. What are they teaching? Because out there, to some extent, the degree does not really matter. It's just name. It's just a name. But the degree doesn't matter. It does, okay. The truth is it does matter because there's a recognition when you say you studied health informatics. People already assume that you focus significantly on things that have to do with data in that sense. So data science, a little bit of AI stats, some sort of evaluation and things like that. So it does matter. But the major thing is what do you want to do with the degree? And then the second thing is, what does the curriculum look like rather? What does the curriculum look like? I mean, so that's the other thing you need to factor into that. So if you see two programs, look at their curriculum, look at and then think of what you want to do. That's the best way to go about it. The other one about approaching your company to use AI. So the thing is, I don't think it's so that's one thing I think people miss a bit in this conversation is that we 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 people don't need to use it. People don't have to use AI. That's why I'm going to say it. They don't have to. But AI could be something they use in the sense that, see, there are problems that you need to solve that all you need to do is to just run regular statistics. Look for a stats person and run regular linear regression model. No, some people say linear regression is not an AI model. Some people argue otherwise, but it depends. But you can just run regular stats. For some problems, all you just need to do is regular chi-square or regular ANOVA. You don't need to run any model, any AI model. So you don't need to use AI. But you need to look at the problems. So that's what I always tell people. Start from the problem. Don't think about AI. What is the problem you want to solve? Okay, let's say you're a nurse and advisor for an ambulance company. What are the problems they have? Look at those problems. What are the challenges they have? Okay, want to know how to prioritize who to go and pick up of, for example, or where to send people or things like that. I don't know what your work exactly looks like. I have an idea. Now, once you look at that problem, how are they solving the problem presently? Then you can now think of is there a way for us to use AI to solve this problem much better than it is being done right now? So don't think of AI as the first thing to do. Now, when it comes to roles, the way the roles are, you see roles people asking for data scientists, people asking for AI scientists, AI engineers, people asking for health informatician. You see people actually asking for health informatician. In some places, you see people asking for analysts. So the roles sort of vary depending on the field, depending on the demands of the roles, and depending on the country. So that's where I'm going to answer that question. So we're going to take the next question. We're running out of time. Abraham, please go ahead.
Okay, thank you very much for the insightful session. So my question is, I've been involved in building some machine learning models and some AI solutions. So one of the limitations I have is in deploying these models, it will actually like accumulate a lot of cost. So my question is there any way to where someone can like get grants for building and deploying and maintaining AI solutions? And how
Yes, there
can
are.
one get it?
No, there are, but the question is, it depends on what you're working on. It's not people. So you see, the thing is, the thing is that there are grants, but those grants are limited. They are much limited. So for you to get some grants, you have to be doing something that the grant is interested in. So unfortunately, unlike elsewhere in Nigeria, there are no grants lying around for you to just do what you want. You have to do what those people want. You have to build something that aligns with what they want to do. So that's the thing. But just go online, search for grants with AI. I mean, it stands for grants AI healthcare. Put grants AI healthcare together in a Google search, and then you're going to see multiple grants. So that's where I'm going to answer that question. There is no specific grant lying around that will just help you to do what you want to do, except what you want to do aligns with what people are giving the money out once. So that's the idea. Unlike elsewhere, maybe in the US, they're like small grants that just lets you do any project you like, but else it doesn't really exist like that because there isn't so much money lying around in a place like Nigeria or some other countries in Africa, for example. So that's the way I would say that thing is. So it's difficult, I've been where you are, and you just have to make do with what you have, or look for someone that you know directly to fund what you're doing. Can we take the next
All
question?
right, thank
Camera,
you very much.
you're welcome. Camera.
Oh, that's no, sir. Thank you very much for an
Yeah.
insightful
Yeah.
session. So, my question is that, for example, I just finished high school in 2023. So, and I'm about to start medical school this year.
Mhm.
Like, is it like I've been told that, combining medical school and like health technology, like AI, might be like cumbersome, or like maybe I might have to like wait till maybe like clinical years, or maybe even after the degree. And that had made me even considering leaving the degree, but I still want to like, focus on like health care. So like what is your like advice on that? That's my first question. And then currently I'm like learning like Python because I want to build this project where I help people with respiratory illnesses with an AI chatbot. But like I'm still like developing the like plan on like how to go about it, how to build the chatbot itself, and how to like get user feedback. So, and does it like require, when it comes to AI, does it like require like software development? Because I see like a lot of people are transitioning from like maybe they know full stack development and then they now transition into like AI. So is it must like first learn like the whole full stack development before I transition into AI? So, and lastly, how can I
No, no,
like
no, you can
implement it?
only answer, there's no time, so I can only take two questions from you. I'm sorry, I say it's 7:56, and I mean, sorry, it's about 4 minutes to the end of this, so you can only ask two questions. So for your first question, what I would say is, what do you want to do? That's like the best way to answer that question. What do you want to do? Like, what do you want to do? And please, you don't have to answer now. What do you want to do in the future? And that's the most important question you need to answer. If you want to focus on data science and AI, then by all means, apply for another degree and go and do either stats or computer science. That's simple. But if you want to be a clinician who does AI, then there's nothing that says that you don't have to, there's no way to it. You don't have to wait. Nobody else needs to wait. When I was in medical school, I was I was um I was a graphic designer. I was doing graphic design. I was doing graphic design for my department. I was doing graphic design for friends. I was even doing it as a business, so to speak. I was making money from it. When I was in medical school, I was doing multiple things before I started working in tech. So it's there's nothing that says that you can't combine it. What do you do in AI? So what do you do with AI, so to speak? You sit down with your PC, you run models, you test models, you try to solve problems and things like that. That is what you do. You're not reading every time. I can say that because so you can't say I don't know what I'm saying. I was in medical school, I finished, I'm a doctor. So you're not reading every time. There are down times. There are times when you're doing other activities. Look for time. Once you're not reading and you're not sleeping and you're not entertaining yourself, work on your AI projects on the side. Work on your AI projects on the side. You can run your model and then leave it and read. There are models that you run and then they take 4 or 5 hours for them to be complete. So put your code together, run your model, read, watch a movie, do everything. So there's nothing that says you can't do that. It's all about you. You just need to plan and structure your time and understand what your primary goal is. So your primary goal first, then your secondary goals come after. That's what I'd say. For the deploying models one, you don't need to know full stack. The good thing is that, like I said, in this age, it's easier. There are things that people have built today that helps you to deploy your AI models. People are using Streamlit and other things like that for you to deploy and test your AI model. So you don't need to build something until you're sure that, okay, people are going to use this, and then you've built something people want. If nobody wants it and you go and build a whole app or something online, then you're wasting your time. But there are lots of tools online that you can use to deploy your AI models. So that's it. So I'm going to take the next question. Cecilia. I don't think. Okay, go on.
Thank you. Thank you for a great session. My concern is you talked about a medical practitioner who leverages their taking care of patients using AI. So I want to ask, like, from their case scenario, how do they on their case, how do they rely on AI? What makes them rely? What gives them, I don't know, 100% assurance that this is working and this is helpful for me?
So the way it's supposed to go is that you don't a computer cannot be held liable. So the computer should not be making decisions for you. So remember when I talked about the renal transplant one, I said it helps to narrow down from a large group. So you as a clinician, you're still going to use your clinical judgment to make the final decision. So the AI should not decide for you. The AI should help you in decision making, which is the same thing people do. Like if you're doing stats will help you to know what correlates, what doesn't correlate. The stats is not the one that is making decision on final decision on what you do. You do. So that's the way that is. So that's the way it works. Now the question you've asked right now is a big issue in the field presently of the fact that how do we apply AI? Who decides on how to apply AI and how safe is that AI in real life? It's an ongoing question that we haven't answered, but it's something that my personal take on is that the AI is not the decision maker. You, the clinician, are the decision maker. You're just using the AI to help you to make a decision. So that's the way it goes. Aga, is Aga still there? If Aga is not here, then Tomilayo, please can you go ahead? And this is the last question. This is the last question. Then I don't know if Rachel is here, but Rachel, can you? I don't think Tomilayo is here. So
I'm here. Hello.
go
Sorry.
ahead. Go ahead. Yeah.
Yeah, thank you so much for your straight to the point conversation so far. I really appreciate it. The question I have is that, yeah, I know you said it at the beginning that you wish you've had a training like this when you started your career. But my question is, what have you learned so far, that big lesson you've learned so far in your career that you would like to share with anyone starting off now, other than training just like this? Thank you.
Yeah, so I'll say the big lesson I've learned so far is that um, just do things. That's what I'd say. You know, the other thing I said the other time. The best way to learn is to do. That's it. So if you've learned something, find a way to apply it. Try to apply it. Keep applying it. The more you apply, the more you learn. The more you have under your belt, the more you can talk about. So I'll give you a very good example. When I was applying for jobs, I realized that it was easier for me to answer some questions because there were things I had done before. I didn't have to think about an hypothetical scenario. I could say, I did this. And when I did this, we did A, B, C, and D. And this is what we did. So that's what I'd say. So keep learning, keep applying, keep doing, and then keep engaging. That's what I'd say. There's nothing else nothing else tops that because it gives you an edge over people. It gives you an edge over people. That's what I'd say.
Fantastic. Thank you very much. Thank you.
Very well. Yeah, thank you, everyone. It's been nice, spending this session with you. I have to go jump into another meeting right now, but you can always reach me on LinkedIn if you have further questions. Thank you very much.
All right. Yeah, thank you very much. We really appreciate your time, Doc, and we've really learned a lot, and I hope we've all learned something as well. If any other question comes to mind in the course of this webinar, do well to pop it in the chat box or on the WhatsApp group page, and we are happy to take it forward from there. Also connect it to one another. The session is still ongoing in the main room, so we cannot leave the breakout rooms now. Back to the main page. We have some very interesting announcements to make as well, so the session still continues.